Hey everybody, my name is Emily Sellens, and I'm here to talk to you guys about the Patient Education Materials Assessment Tool, or PMAT. So I'm very passionate about being able to connect and communicate with patients at a holistic level. We have been in situations before where our patients are not all cookie cutter, we're just going to get along and be able to communicate effectively right off the bat. So this tool is designed to help make readable materials that patients can take home or find online the most understandable for the patient to be able to understand the information. So what are some common communication barriers in healthcare that you've experienced as nurses? I'll write some down on the board.
People not being able to talk or hear.
Okay.
Language barriers.
Yeah.
Language barriers is big. And even
Cultures.
in my culture, in my experience, using a translator phone is still not as effective as if I was speaking to a native English speaker.
Mm-hmm.
Illiteracy.
Illiteracy. So that is pretty much the big focus that I want to focus on today, but all of these are correct. I have a couple listed here. Environmental, maybe the room is too noisy, neighboring rooms are too noisy, it's not conducive for the patient to be able to understand what you're communicating. Got gender, cultural, and age differences, impeding ability to understand material best. Patient anxiety, pain, or discomfort in the situation can affect how people remember things. I've been in situations where I've been afraid or in pain and I was not listening word for everything. A lot of it is jumbled and I remember it a little bit differently. Healthcare providers lack of time. I've noticed that a lot in situations when nurses are stretched thin. They get to the point and don't really have a lot of time for questions, which can affect communication. And like you touched on, Tori, literacy is definitely what I want to focus on today. And people will have different literacy levels, and how can you as a nurse be able to help them have materials, discharge materials, websites that are credible to use so that they are getting the best information. So what is health literacy? Does anyone have a definition off the top of their head that they could describe health literacy as?
The ability to read healthcare materials.
And understand.
Right, yeah. No, that's great. Yeah, so the Department of Health and Human Services defines it as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So that is incredibly important because everyone is going to come in with a different health literacy level, and therefore that is going to affect every aspect of their care. And a lot of times as a nurse, I've seen a healthcare provider like a doctor come in, explain a procedure, and you can kind of see a blank look on the patient's face feeling like, I don't understand what they're saying, but I'm too embarrassed to say I don't understand. Or you'll hand someone a piece of paper and say, just read over this while I do something else. And they say, okay, do they have any questions? No. That might not be the most effective way to ask that question. That's not, they could be lying. They could be too embarrassed to say that they couldn't read that fast, or they don't understand the words, and they just trust you because nurses are the most trusted profession right now. So that's where this PMAT tool comes in. So I'm going to hand this out. Pass that around. So this is a created user guide where you can take any visual source, educational source, use this chart to go through, and it will rate the understandability and the actionability of the content that you're reading. So the first step is you want to read the patient education material. This could be a website, this could be a printout that you see in a doctor's office or wherever you're working that is frequently handed out. Then you're going to rate the material, go through first the understandability category and then the actionability category. So you score each item based on disagree or agree, and it shows you there in the response options. Disagree counts as 0 and agree counts as 1. And then at the end, you interpret the score. So each section on the back of this handout has total points, which you would add up all of the ones that you have, total possible points, which in the understandability category is 19, and actionability is 7, and then so you divide the total by the total possible, and that gives you how much of a percentage it was understandable for the average person to understand, and the actionability. How can somebody actually use this material and put it into their own lives, like actually work action off of the information. So I have an activity for us. I have 2 different handouts. One is from the CDC and one is from the Public Health of Virginia Department. So each of these are about the same thing. This is the influenza, new things in the area. So, if you don't mind passing those. What I would like you to do is you can use one of the materials or compare both of them and just rate that material as you best see fit. I chose 2 materials here that discussed the same theme of the influenza, just to show that any patient who just Googles flu symptoms, these are 2 of the top hits of patient information. So you can maybe understand how someone would feel reading these. So if you would like to start that activity, that would be great. So averaging that out, as a group, we're rating that the understandability of the Virginia Public Health is about 83%, whereas the CDC is about 43% understandable. Does anyone have any scores for the actionability category?
I have 43% for the CDC,
43 again?
and then 86% for the other one.
Some of the points were not applicable.
And that's why I have it in these on the change.
Yeah, you
I
just
would count it out of fewer points then, right?
Mm-hmm, correct.
Okay, that might be part of my problem.
So actually what I'm hearing, this is a good talking point for sure. Understanding that if you null something, do you divide that or not, is definitely a critique of using this tool. Does anyone have any other critiques that they have felt using this so far?
I just like that this jumps right into, well, this paper specifically just jumps right into all about the patient. Whereas I suppose this is giving you the background
Right.
of viruses and a bunch of different jargon that I look at and as a layperson would be completely overwhelmed.
Exactly.
Absolutely. It's overwhelming for someone who is in this field, you know, is surrounded by this and this kind of talk all the time. That's even
Right.
almost upsetting to see I'm not getting the answers I need.
Exactly.
So I
Even
definitely wrote overwhelming from what we said. Do you have any other words to describe that paper?
I would also, like, even looking at it, I look at it and I just skip through it because, again, overwhelming, it's just too much information, whereas the patient just needs to know direct details.
Yes.
Agreed.
How would you describe the public health one, the symptoms?
I like the public health one. I like
Yeah.
the fact that it has It's all
gets straight to the
patient led,
point.
and then the chart on the back is giving you the information about the
Yeah.
symptoms and telling you if it's whether flu and cold. I think it's straightforward and very understandable.
Yeah.
There's something to be said for graphics and patient information too. I specifically like the part where it rates the organization and that the material is broken into chunks. I think that breaks a whole pie into smaller bites to chew, and you're able to understand what they want you to get out of it.
Right.
Or if it doesn't apply to you, you can skip it and go on to the next, and you don't feel like you need to read every single word to
Yeah.
get what you need out of it.
Mm-hmm.
How does everyone else feel about anything else? Either?
I mean, kind of the same. I like that, like, even if, like, I don't try that hard to look at the, like, just basic flu symptom one, from the Virginia Department of Health, right?
Yeah.
Literally, like, even if I just glance at it, I can see common flu symptoms, okay, fever. Like, very simple. I don't have to sit there and look through all of the bullet points. Whereas the other one, even if I glance at the paper, I don't really see what's on there because there's so many words.
Mm-hmm.
Yeah.
I will tell you as a parent, the one from the CDC, which is worse,
Mm-hmm.
this is really typically what we would get from the pediatrician.
Okay.
Mhm.
Yeah.
Is the more information on there that is giving you all the information, but it's just, again, too much.
Mm-hmm. And that in itself keeps people from
Yeah.
actually learning the information because it's like, this is overwhelming.
'Cause even if
Me
you're-
personally, when I go to the pediatrician and they throw stuff at me like that, it sits in a drawer.
It's multiple
I'm not
pages
even
like
gonna-
that too.
Yeah.
Mm-hmm.
You know, so yeah.
So it's not effective. So as
Exactly,
a
it's wasted
future
paper.
nurse, would you be likely to use this tool in your practice if you work in an office and you see materials out? Would you use this tool to see?
I think it makes you more mindful of
Mhm.
the material you are providing, because if it's
Exactly.
not something that you can understand,
Mhm.
the other person is not going to understand it
Exactly.
at all. They're not going to be able to follow the directions that you're giving them or continuing with their care, which at that point you're having people that are no longer compliant, but it might not be a choice that they have. It's just they don't understand what's happening.
Mhm.
I
Right.
think, like, maybe too, like, for a nurse, I feel like one of our biggest things is advocacy and advocating for our patients. So if you typically give out a flyer, like the one that is really wordy, and you don't agree with that, you don't think it's effective, you could even use this tool to rate it and show, the healthcare provider that you're working for, like, hey, why don't we use a different pamphlet?
Right.
Kind of
Exactly.
update,
Wow,
yep.
just simplify it. Yeah.
Yeah, that's great. That was my aim in teaching this, was to be able to take a step back, because it is easy to overlook, and this is the protocol, this is the information we provide patients, and handing it to them, and then that's it.
Shoving them out the door.
Mm-hmm.
Yeah.
It can be. You're right. What is going to increase that patient's experience in that healthcare setting? What is going to decrease any complications once they leave? What is going to decrease readmissions because not understanding discharge instructions, or when to call the doctor, or coming back, for situations they don't need to be. So I think by, education, you can really combat a lot of that.
Mm-hmm.
So just to come back around to the barriers of communication we talked about earlier, what would you do as a nurse to combat some of the barriers that we talked about earlier?
I like the charts. I like the pictures.
Mm-hmm.
The bulletproof, or the
bullets.
bulleting. Yeah. Just the organization of the paper has to be understandable and direct and easy to follow.
Mm-hmm. And I heard you talk about earlier, Tori, about advocating for the patient. So other ways that you can advocate for your patient while you're communicating with them, can you think of anything?
You can go over it with them
Mhm.
and ask
Yes,
them if they
absolutely.
understand. Like, if it's hard for you to understand and they're willing to tell you, yeah, this is a little bit much for me, then you can advocate for something different, something that'll be easier on their level to understand.
Absolutely. Any other questions or concerns, Mel?
Oh, I think this was great.
Yeah.
Great. Well, thank you so much for coming tonight. Talk.